Welcome back. This Friday is the American Hospital Association's National Day of Awareness to End Violence. That is, violence is an issue both inside and outside of healthcare facilities. Here to talk about decreasing it is Dr. Anuj Mehta, a pulmonologist over at Denver Health. Dr. Mehta, it's really good to see you. Thanks for coming in. I appreciate it.
Thanks so much.
We have a few minutes to focus on both types of violence here, but I want to start with violence that may shock a lot of people outside of the healthcare system. And medicine is that workplace violence against healthcare workers is increasing. One study I saw shows that nurses are assaulted every 30 minutes. What is going on here? Why is this happening? What can be done to stop it?
So this isn't something that's new, but it is something that's getting worse over the last 3-4 years. COVID kind of spiked a lot of the violence against healthcare workers. We're seeing it against nurses, we're seeing it against respiratory therapists, the people that transport you, and against doctors. And it's a combination of people being frustrated with, society in general, but also, it's coincident with the mental health epidemic that we're having and some of the addiction issues that we're dealing with. But it's really affecting the healthcare workers in a really big way. Similar to flight attendants, I think they're struggling with some of the similar things.
So how do you start at the root of this to try to stop the problem? Because I imagine some of that, the same reason that causes the violence against healthcare workers, causes some of the violence we see outside in the community.
Yeah, so one of the main things is differentiating people that are violent because they're violent from mental health issues or acute medical issues. And I think Denver Health is really taking the lead here. And when we have people with mental health who are in the hospital who decompensate from a mental health issue, we have now a specialized team of mental health experts. I know a lot of people are trying this in the community, as opposed to having security or police officers respond, having a team of mental health experts. So that's really helped us from in de-escalating situations. But then you have people that are just angry and want to punch a nurse or punch a doctor. When I'm in the ICU, people threaten to kill me literally almost once a week. No.
Are these people who are there who are needing medical attention from doctors like yourself? Is it their family members? Who is this?
Both. And the nurses get it even worse because they're in the room much more often.
So what do you do? How do you respond?
It's still our job. The reason we're in this work is to take care of people who are sick, and so we do our best. People that threaten me get the same exact level of care from me. I know my entire team at Denver Health is the same way. But we also, as an institution, and I think all healthcare institutions, are really cracking down. And when people either assault healthcare workers, there are consequences. And I think what's great, one of the things at Denver Health is that they support us when we want to take that route. And I think other institutions are recognizing that this is a growing problem, that we need to expect the same level of behavior and respect that you would expect in the grocery store. And we see that that's, not happening in hospitals and in healthcare settings. So I think all of us are really working for different ways to figure out how to make the work environment safer.
Okay. Well, thanks for what you do. Thanks for bringing light to that, and stay safe and keep on helping people.
Thank you.
All right, Dr. Anuj Mehta from Denver Health. Appreciate it. It's really good to see you.